And those are some of the headlines. This is Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman. Well, today is Veterans Day. We begin with a new study that estimates 4 times as many U.S. Army veterans died last year because they lacked health insurance than the total number of U.S. soldiers who were killed in Iraq and Afghanistan in the same period. A research team at Harvard Medical School says 2,266 veterans under the age of 65 died in 2008 because they were uninsured. Their estimates are based on their recently published findings in the American Journal of Public Health that shows how being uninsured raises a person's odds of dying prematurely by 40%. The researchers also found that nearly 1.5 million veterans between the ages of 18 and 64 were uninsured last year. While most veterans are eligible to receive care from the Veterans Administration, those who are not injured in combat and whose income is above a certain threshold are often ineligible. The report's authors say the health care legislation pending in the House and Senate will not significantly improve the situation. The co-author of the report, Dr. Steffie Woolhandler, joins me here in our Firehouse studio. She's professor of medicine at Harvard University and a primary care physician in Cambridge. She's also co-founder of Physicians for a National Health Program and testified about uninsured veterans before Congress in 2007. We welcome you to Democracy Now! I mean, these are astounding figures. Tell us exactly what you found.
Well, the risk of dying is actually elevated by about 40% among people who have no health insurance. And there's just under 1.5 million uninsured veterans nationally. So applying those odds to those folks, it turns out that there's almost 2,300 veterans who die every year due to lack of health insurance. Many of these folks, these veterans, would not be helped under the bills before the House and Senate because they'll be too affluent to qualify for Medicare if they get subsidies at all. For Medicaid, if they get subsidies at all, the subsidies will be too small to make health insurance affordable. And they're mostly working families, folks who don't have the money to buy private insurance, but they have too much money to qualify for Medicaid or means-tested VA benefits.
I think people would be very surprised to know that once you're a vet, no matter what your income level, you're not covered by VA healthcare system for the rest of your life.
Oh, well, that's been true for a long time. The VA will cover you if you have a service-connected injury, like you get your leg shut off. They do provide a safety net for people with very low incomes, eligible for Medicaid or slightly higher incomes. However, many middle-income vets are not eligible for VA care, and that's who these uninsured veterans are. And sadly, many of them will continue to be uninsured under the House or Senate bills, which, even if they work as planned, will leave somewhere between a third and a half of all uninsured people still uninsured in the year 2020.
What's the VA saying about this?
The VA did show up at the hearings, and I think they would love to have more money in order to be able to expand the care that they give. In fact, I think the VA is a good system and actually a good safety net if you can get access to it. But currently, there's just not the funding within the VA system to allow them to cover all veterans.
Are there any examples you can share with us of what has happened to a veteran?
Well, we did hear stories from people. Often they were folks in the middle income ranges. They'd been out of the service for 2 or 3 or 5 years. They were working, but they were not getting insurance through their work, and they could not qualify for VA care. Similarly, there's only a limited number of VA facilities. They're in a lot of cities, but not all cities, and many people just couldn't get to a VA facility even if they were eligible.